Hi everyone, my name is Tamara Galbert, and today I'll be presenting on Washington's RCW 13.34.050, the law that allows for emergency child removal, often in situations involving addiction. Before we get into the data and details, I want to start with a quote that really captures the heart of this issue. Protecting children is not just about removing them from danger. It's about building the conditions where families can heal and grow together. I think that line says so much about the tension behind this policy. It's about balancing safety with compassion. Imagine a toddler found unresponsive in a home where fentanyl was present. Sadly, scenes like that are becoming far more common. In Washington, opioid related child welfare cases have increased 11-fold between 2020 and 2023. RCW 13.34.050 is the law that allows the state to step in immediately when a child is believed to be in danger. But when addiction is involved, we have to ask, is this policy truly protecting children, or is it punishing parents? RCW 13.34.050 authorizes law enforcement or child protective services to remove a child from the home immediately, without a prior court order, when they believe the child faces imminent danger. A shelter care hearing must occur within 72 hours where a judge reviews a decision. The intent is to prevent tragedies by acting fast. But as we'll see, how imminent danger is interpreted, especially when addiction is involved, can vary widely. In 2024, lawmakers responded to the fentanyl crisis with two bills that changed how this law is applied. Senate Bill 6109 requires judges to give significant weight to fentanyl exposure when assessing risk. House Bill 2447 focuses on training child welfare workers and expanding addiction treatment for parents. Supporters argue these changes strengthen protection. Critics worry they increase removals and deepen trauma, especially when parents fear losing their children if they ask for help. Research shows more than half of all infant removals list parental substance use as a factor. The most frequent substances are opioids, methamphetamines, and alcohol. But behind those statistics are stories of families also coping with trauma, poverty, and mental health issues. Importantly, not every instance of substance use equals child neglect, yet our systems often treat it as if it does. That misunderstanding fuels unnecessary separations. This policy was created as a crisis intervention tool for those moments when a child is believed to be in immediate danger and no safe caregiver can be found. It's intended to save lives, but in practice, it's applied most often to families affected by addiction, even when no actual harm has occurred yet. That's where the ethical and emotional conflict lies between protecting safety and preserving family bonds. For therapists, this isn't just policy, it's part of our clinical reality. We work with families involved in CPS, and often we're the bridge between fear and trust. The challenge is walking that ethical line, protecting a child's safety while supporting the parent's recovery. Knowing how RCW 13.34.050 functions helps us document appropriately, advocate effectively, and prevent unnecessary trauma. Therapists can influence policy more than we realize. We can share what we see in the field, the gaps, the barriers, the human stories, collaboration across systems, social work, healthcare, and courts ensures families aren't falling through the cracks. And we must center equity. Families of color and those living in poverty are more likely to lose custody under this law, even with similar circumstances. Advocacy means making sure protection applies to every family, not just the privileged. Other states have explored innovative ways to address substance use and child safety. Florida uses dependency drug courts, where parents receive structured treatment and monitoring instead of losing custody. Ohio's EPIC program connects families to peer recovery coaches, treatment, and coordinated court oversight. These examples show how policy can shift from punishment to partnership, reducing removals while keeping children safe. This law absolutely has value in true emergencies when no one else can protect a child. But when it's applied automatically to families struggling with addiction, it can do harm. Parents may avoid treatment out of fear. Children may experience trauma from separation that lasts years. So the key question isn't whether the policy should exist, it's how we apply it fairly. To strengthen this policy, we can emphasize treatment and prevention over punishment. Expand kinship placements so children stay within family networks whenever possible. Ensure therapists have a voice in safety planning and reunification efforts. And most importantly, reframe addiction as a health condition, one that needs healing, not separation. To wrap up, RCW 13.34.050 gives Washington the power to act quickly when a child's safety is at risk. But when addiction becomes the automatic reason for removal, that power can unintentionally cause more harm than help. As therapists, we're in a unique position to see both sides, the need to protect children and the need to help parents heal. Understanding this law helps us work ethically, advocate compassionately, and challenge systems that confuse addiction with neglect. I'll leave you with this question. How can we support families better? Every policy has the power to protect or harm. As therapists, our role goes beyond the counseling room. We can advocate for trauma-informed systems, equitable care, and policies that protect children without punishing their parents. Thank you for watching.